Dr. uh, Kumar Belani, who is the international professor, academician at the Minnesota. And again, we have heard him in the past. He has been introduced to the audience in the past. So I'm not spending time on his detailed introduction, but I won't want his comments. Dr. Belani, again, what is your kind of take on this particular scheme?
Good morning to all the elite panelists, and good to be here. The talk today, as you know, is the Digital Health Mission for India, and I'm at the University of Minnesota in anesthesiology, medicine, pediatrics, and the School of Public Health. Our university, as you know, is one of the top 10 public research universities. So, good morning from the university itself. We are situated in a land of 10,000 lakes. Now, in the USA, we do not have a digital health card. I think the program that you have presented is quite ambitious, and I hope it works out well with this large population in India. What I have is a health card which is given to me by the university, and then I also have a Medicare card. I'll talk a little bit about this card and what it does and what it doesn't do. The Medicare card, as you know, is a federal program which was started by Lyndon Johnson, President Lyndon Johnson, and it provides health coverage if you're 65 plus, and under 65 if you don't have disabilities. I mean, if you have a disability, no matter what your income is, and it covers inpatient care, skilled nursing facility, home health care, etc. The other card that we carry, which people can get, is called the Medicaid card, and it's a state and federal program that provides healthcare coverage with people with very low income. And you can actually have both cards depending upon your financial eligibility. Now, there are services that are covered by Medicare, and there are services that are covered by Medicaid. There are some differences, and these are programs, like I said, administered by the government. Now, Medicaid, for instance, will cover services that Medicare does not, like long-term care, and it can also pick up some of the Medicare's out-of-pocket costs like deductibles and co-insurances and co-payments. Now, Medicare has four parts. Part A provides for the inpatient hospital coverage. Part B, for those that would have to pay for outpatient and medical coverage, you need to get an additional group premium for this. Now, for me, because I am employed at the university, my card, the other card, Medicare card that I have, will take care of that. And there are some people who prefer Part C, which is an alternative way to receive your Medicare benefits. And Part D is the one that provides for prescription drug coverage. So you can see here, the program that I'm calling is ambitious for what India wants to do, is that as years go by, it becomes very difficult to provide all the coverages that are needed. And in the beginning, when it was started in the 60s by Lyndon Johnson et al., there was a lot of misuse of the Medicare cards, and that's why these issues have come up. So I think when you introduce this card, there has to be close monitoring that people stay within the principles. Otherwise, there will be fraud and there'll be misuse of this card, and the budgets that are laid aside will pretty much get over pretty quickly. Now, Medicaid has funded programs for different groups of people: older adults, people with disabilities, children, pregnancy, etc. And some states will also offer a Medicaid spend down program or a medically needy program for individuals with incomes that are over their state's eligibility requirements. So a spend down program allows individuals to deduct their medical expenses from their income so that then they can qualify for Medicaid. Now, if one is eligible for Medicare and has a sufficiently low income, he may qualify for special help from certain Medicaid programs in some states. Whether one qualifies or not depends on their age, whether they have blindness, whether they have disability, so on and so forth. So I'm bringing these issues up because y'all are going new into the system, and all these things have to be thought of before you jump into this ambitious facility. Now, the most important thing is, how do we protect individual health data? And for this, HIPAA was implemented in 1996 and was enacted by President Clinton. And this protects your data in the whatever health data that you have. You can't even, I cannot even look at my wife's own medical information if at the hospital if she is a patient, because I will be penalized if I did that unless I get a permission. And so we have to sign a release, and the medical data on that on the electronic medical record can be released by a program called Care Everywhere, and that's how it can be sent. So this allows doctors, nurses, pharmacists, and other health providers and patients to appropriately access and secure the patient's vital medically information electronically, and it improves the speed, quality, safety, and cost of patient care. I will conclude with this slide here, which shows there are three key forms of health information exchange. One is directed exchange that allows this information to be transferred between providers, and then one that's called query-based exchange. It's the ability for providers to find and request information on a patient from other providers, and the consumer-mediated exchange, which is the ability for patients to aggregate and control the use of the health information amongst providers. So there are many practical issues that one has to consider, especially in a country like India, where you have such a large population, such variability in the reach of patients, and then there can be a lot of misuse, and so that has to be monitored closely. Thank you.
Thank you so much, Dr. Belani. And I think you again, you have highlighted very important part of the issue of the privacy and of course some of the intent which has been woven into our program. But considering our country where this issue of privacy, which is so much of a need in United States, is not so much is being at least voiced over by people in our country, and it is like very, very heterogeneous